Welcome everyone for joining in. We are interviewing Dr. Toni Muzzonigro today of Optimum Direct Care. Toni, also known as Dr. Muzzy, is a board-certified family practice physician. She's a South Florida native and graduated from the University of Florida, where she earned her undergrad degree in nutrition. Dr. Muzzy also went on to earn her medical degree from Nova Southeastern University in osteopathic medicine. Then she completed her family practice residency at Botsford Hospital in Farmington Hills, Michigan. And that's where she became a board certified family physician in 2010. Dr. Muzzy has also thoroughly enjoyed working with her direct primary care setting. It's given her time, get to know her patients on a deeper level and create long-standing relationships on a mutual respect level also. So thank you for taking time out of your day to do this. And are you ready to make Orlando a healthier place?
Absolutely. Thanks so much for having me.
Good, perfect. So the first question that I have is for people who are watching who may not know, what is direct primary care versus standard care? What's the difference and what is DPC really?
Yeah, so for anybody who hasn't already heard of direct primary care, what it is a membership-based model for primary care healthcare delivery. So rather than going to the doctor, in a standard practice where everything is kind of dictated by insurance, in a direct primary care setting, the patient actually pays a monthly fee to the doctor, which allows them to have the access to that doctor, the doctor's office. So everything that takes place with between the patient and the physician is without any third-party involvement. So this allows doctors to have many fewer patients on their panel, giving them much more time with each patient, and opens up that time in their schedule so that they can see people that same day when they're sick, as opposed to, you call your doctor's office and they can't get you in for weeks, even though you're very sick today. And so really the model, at its core, it's to incentivize wellness as opposed to emphasize, sick care, which unfortunately, as the insurance-based world, we all know, you get sick enough, then you go see the doctor, but you have a copay, so human nature makes people put things off longer probably than they should. And maybe some people are deterred by having to pay, specific to the visit. When you're a member of a direct primary care practice, your membership fee basically covers anything that that doctor can offer you. And so you need to come in today, tomorrow, because you're not feeling well. That's part of your membership fee.
I think you said it best right there you said it's more of a proactive approach instead of reactive. It's kind of unfortunate, our society, we wait till stuff happens until we start to make changes. But sometimes after you have a heart attack or after you have a stroke, it may be too late to start making changes. To be able.
Yeah.
So this model is not only just to take care of you just when you're sick, but also a proactive approach. What if we can prevent disease from actually occurring? What if we can prevent the stroke from actually occurring? What if we can prevent sickness from happening? So what I hear you say is it's more of like a shift now to not only is it that you're someone's primary care physician, but yet we're going to try to prevent disease from actually happening, prevent you from getting sick, and being more of a wellness model.
Exactly. And doctors who are practicing with the boots on the ground in, the standard fee for service, model, they all want that, right? They all went into medicine because they're passionate about helping people. They gave up all of their 20s, right? So that they could learn all of this knowledge and be able to really connect with people and make impact for change. And they become disenchanted. And so when patients feel frustrated that the doctor didn't spend enough time with them, guess what? That doctor's just as frustrated as you are. And that's why doctors get burnt out, because they don't get that fulfillment that they sacrificed their whole life to become a doctor we're not altruistic as much as we would like to be. We want to feel good about helping people, and it's hard to do that when you're rushed through visits like doctors are.
Because the standard system That's one of the biggest complaints that we hear here is that the physician
Right.
spent 5 minutes, and it's not the physician's fault
Yeah.
for that. It's actually because he's forced to see, or he or she's forced to see
Right.
5 patients this hour, so he has to get in, get out, get in, get out, get in, get out, because he has to see everyone. So that's a
Exactly.
very common
And same
complaint
as
that
your
we
model,
do see. Yeah.
you've removed the third party from your model, and you spend that same one-on-one time with
Hmm.
patients, and it's just makes a tremendous difference. That you're just time.
Yeah.
So the trade-off is for your time, and it's well
Yep.
worth it.
So for those who are interested in a direct primary care model, um, can this save them money and help improve outcomes?
Yeah, there are some actual hard numbers, some data to support that direct primary care does drive the cost of healthcare down, but those are difficult studies to do, of
Yeah.
course, and the amount of direct primary care practice is always changing, and the amount of them who are actually keeping record of that, it leaves a lot to be desired, probably. But when you think about it, you have access to your physician essentially any time that you need, right? So if something comes up on a Friday, as it always does, or on a weekend, and you're contemplating, should I go to the ER? I know I'm going to spend $75 for a Tylenol if this is just viral, or, they may find some medical reason to do 3 different scans on me that could amass a bill of $4,000, right? For a
And add
one
in the
time.
$1,000 fee just to go to the ER.
Yeah,
Don't
right.
don't
So
forget
so
that
you
one
have
too. Yeah.
you have a doctor who's already spent a lot of time getting to know you and your unique background, and just the subtleties of what make you you, medically and socially and spiritually and everything, right? And so you have that person that you can reach out to at any time versus a stranger who's a doctor who has all good intentions, but they just met you, they don't want to get sued, so they don't want to miss anything, and you're in an acute care facility. Like their job is to make sure that nothing catastrophic is going
Yes.
on, and oftentimes the bill reflects that. They want to be on the safe side, and I don't fault them for that. But a lot of
Hmm.
people who end up in emergency rooms truly don't belong there.
Yeah.
And so from that regard, obviously direct primary care can offer savings. But also, patients who are members of most direct primary care practices, ours included, offered, cash negotiated, reduced pricing on most things, right? So that's
Yeah.
lab work, it's imaging. There are some specialists that we have agreements with who will see our patients at a reduced cash rate. And so across the board, it's just kind of free market in medicine,
Yeah.
right? It's free market forces just trying to drive the cost down, and pricing transparency. That's a huge
Hmm.
thing. That's a huge part of direct primary care that we all know is missing from general fee for service medical
Hmm.
care. And that's
Yeah.
why the prices of everything have skyrocketed, because
Yeah.
nobody knows what anything costs.
Yeah.
So just
And
knowing, even if it's expensive, just knowing how much something costs, you're gonna make informed decisions, right, before you go do a test. Make sure that
yeah,
it is in fact
I
something that's
think
indicated.
one of your for some examples, one of your examples that you just listed was really the cost savings you get from negotiating deals within your own network, like an MRI at the hospital, maybe $1,500,
I
where
don't
you
even want to
can
know, right?
where you do an MRI for $400, or an
Not
MRI with
even, but
contrast for
yeah,
maybe like
right.
450 or something like that. Because I remember when I was doing my dissertation and we
Mm-hmm.
were doing MRI stuff, if we wanted to use the MRI machine during peak hours, it would have cost us like $1,500. And
Yeah.
as the evening came on, then if we wanted to use the MRI for research, then it was like $750. And then at
So
nighttime, at like 9 o'clock p.m., when no one was using it, they would let us use it for like $250 a pop. So the actual cost of the MRI is so inflated in
Right.
some standard hospital systems. That's an example right there of how you can save money by joining a direct primary care model like this, is where if you need a MRI, you can easily get it quick, fast, and easy for a much lesser amount of money, whether it's a radiograph, whether it's MRI, lab work. These are all options that you can get major cost savings. And then the other example that you said was the ER, and then the ER visits that's one of the main problems of why healthcare is so much, because a lot of people who go to the ER don't need to be at the ER. And
they just don't have, they don't have a primary
yeah,
care doc, or they don't have access to their doc, you know.
Yeah. And
Sorry, good job.
just going to the ER is $1,000 plus the testing, plus the admin stuff, plus, yes, as you said, they're trying to, rule out all possibilities of this thing. So they may do extensive testing, which is going to raise up the bill more versus coming to you, seeing a physician that you already have a relationship with, and you can get in and get out faster, easier, with much, much less cost. So those are two just simple examples right there of how you can save money. But I also wanted to kind of dig in a little bit deeper into your business, and what are some of the benefits that you guys offer at Optimum?
Yeah, so I mean,
that we can just highlight on.
a lot of the things, you know, that we've already discussed, which are just inherent to the direct primary model, you know, and these things are invaluable. And I really appreciate being able to spend lots of time with patients to see them when something is actually wrong and not have to hear about it because they ended up in the ER. But, you know, so I think establishing that foundation, you know, 90-minute long initial visits where you learn about everything related to this person's history. In our office, we also offer a formulary of generic medications for free. So that's a member benefit, I would say.
Let's not even go into that one yet, because I think that's a game changer for you guys. So before we even, yes, she did say free medications. So I think that's going to be a game changer. But for some of those who are actually watching right now and don't know what it is, or maybe interested in this. So the first thing is one-on-one care. I think, which I am a personal member of her practice also, and it's one-on-one care. I love it. You're there, you establish a personal relationship. It's an extensive eval. You go over everything. It's thorough. It's one-on-one care. No more 5 minutes here, 5 minutes here, or you didn't even take the time to listen to me. A lot of patients say that also, that they didn't even listen to what I had to say. They just saw me, told me to go here, and just go somewhere else, and that was it. So
the
one-on-one
fragmentation, care is, right?
Yes, the one-on-one care and developing a personal relationship with your physician is probably the number one benefit. So then, two would be the free medication. So let's talk a little bit about that. How are you able to even do that? Because this is a new concept, and I truly believe it's going to be a game changer for you.
Well,
but
yeah.
how are you even doing free medication with your practice?
Let's just say if patients actually knew how much medications actually cost, they would, instead of being excited when Target offers a $4 list, or Publix, or whomever, you know, the Walmart $4 list, you could look at that easily and say, that's highway robbery still, because a lot of these medications are pennies a pill, right? So if it's $4, we're used to paying a $20 copay, and then the branded drug was 60 or 70. That's absurd. Okay. So, you know, as an example, somebody who takes a atorvastatin, I've had patients who were spending like $140 for a 3-month supply. Even when we used to charge for medications back in the day, like at our direct primary care practice, that 3-month supply added up to like $7 or something like that, right? And then we would just charge our costs. So, but we figure as a, you know, as a perk to the membership, like why even bother quibbling over cents and a couple of bucks here and there, you know? And of course we try to keep people off medications as much as possible and focus on ways to
Yeah.
modify the lifestyle and diet and all that so that we knock medicines off their list as opposed to add to them. But I guess, the incentive is there to do that as well. But yeah,
I'm never an all or none. Medication has its place. Medications has helped
sure,
multiple diseases or help people manage them, and there's a time and place for it. Obviously, in our
absolutely.
society, we overutilize like medication, but I think that's an awesome benefit of your model to be able to offer that, and it shows that you're really doing what is best for the patient to a point that you're offering free medications, and it's not like you're upcharging everyone to try to make a profit,
Right,
but yet you're
right.
really doing what is best for your patients with this and giving them
Yeah.
the opportunity to get free meds that way. So I think
Yeah.
that's
And
awesome.
even our supplements, we don't upcharge them. Our patients get our cost. And that way I feel good about just recommending what I
Yeah.
feel is indicated and not getting any sideways glances from people, who might think you have ulterior motives, but truly it's just what's best for each individual, that's what it comes down to.
Yeah. So that's definitely one of the big benefits also of her direct primary care model also is the free medication. Are you dabbing into any telehealth at all? Do you offer telehealth services?
Yeah, we only to our members, but we are able to FaceTime, video chat. We text with patients all the time, email, phone call, however we want to get the job done. Usually, that could take place during your work day. You're at your office and you don't want to spend a half a day taking off to go to the doctor to get something addressed that you could manage just by sending a photo or explaining your symptoms, and so we knock that out in 15 minutes so you don't have to leave work and you could just do it on a break.
Yeah.
So sometimes it's that, right? Telemedicine to our members during office hours. Oftentimes it's after hours, just people wanting to go over a concerning symptom that they're not sure if they need to make a big deal of because it's a Saturday or if it could be
Yeah.
addressed next week or what have you. So yeah, so absolutely. Or if, it's Friday night and your medication was sent to the pharmacy, but then you get there and it's not there and you shoot me a text and it's taken care of, you don't have to
Yeah.
wait for an answering service or
hmm
not, or nobody may ever call you
Yeah.
back,
I mean,
so.
I think that's awesome. So, like, again, there's multiple benefits for this, but for some of you who may be watching this who aren't tech savvy, who don't know what telehealth is, it's really taking advantage of technology and using it as a medium in order to communicate and reach out to your primary care physician. So whether it's texting, email, whether it's a video chat, exactly like this. Say you have a problem or say your child's sick and instead of going into the actual clinic and getting additional fees
Right.
that way just to have a site visit, you have instant access with Toni pretty much, and you could ask her questions, problem solve that way, and see what is the best next step for you, whether you have to come in or whether you just have to go to the pharmacy or not. So this is another benefit that a lot of clinicians still aren't taking advantage of, but taking advantage of telehealth services, not adding in those additional costs that way with just a site visit, but you have instant access. So this is another benefit which I love because if my daughter gets sick or there's a rash or something going on, you could instantly just text you, call you, email you, say, hey, this is popping up. What do you think? Do I need to come in or what is the next step with this? So it's like 24/7, almost instant access where I
Right.
don't even have to leave work. I don't have to leave my home, and I can still ask you a question to do what's best for myself or do what's best for my daughter or my family. So that's another awesome benefit that a lot of people are not offering yet. So I think that's another thing that
Yeah, and
your whole team is
hopefully
doing great with.
hopefully in the future, even fee for service docs will be able to do telehealth. They just can't right now because there's no time in their day. And because they're based on reimbursement, most practices are not set up to be able to be reimbursed yet for that time. Whereas we're not looking to be reimbursed for any allotment of time because it's just a fixed membership fee, basically.
So you briefly mentioned it also, which would be like the fourth or fifth benefit is supplements. Can you talk about that? What do you do supplements for? What part of program
Yeah.
is that for? And then you also said that you don't upcharge them either, which is awesome too. So let's talk
Yeah.
a little bit
So
about supplements.
so in my standard training, I'll be honest, I didn't use a whole lot. My mentors didn't use a whole lot of supplements, but probably because I've been in direct primary care, I've had a lot of time to do a lot of self-study and research, and there are things that I've been incorporating along the way that I just find really work well for people. And so we have a online dispensary called Full Script that our members have access to. And I think in order to be on Full Script, you have to be invited by a provider of some sort. And so at our practice, we also do a little bit of advanced testing. We do micronutrient testing, we do advanced cardiometabolic testing, and some food sensitivity testing and such. So often the results of these tests will, necessitate potentially supplements, and we try to address everything that we can by way of diet and try not to make people, take a bunch of pills all the time. Sometimes in the beginning it might seem that way, but we ultimately are trying to get people in the right state to where their health is kind of all working seamlessly and they have all the required building blocks and what have you. So anyhow, so we decided that we don't want to upcharge the supplements. You have a choice, you can, on Full Script, you can mark up, but we just chose not to do that because we just want for people to have easy access to what they need.
Which is, again, it's an awesome benefit. I think kudos to you and your team. Shout out to Gary also for that.
Holler.
And, but like, this is another benefit here. So, me being a patient also, I would definitely say that for those watching, this isn't just garbage, watered down, overpriced supplements that you can get on the counter, because I think a lot of them are. It's just like, if nutrient X shows results, you only get like 10% of nutrient X and the rest is garbage stuff. So these are actually
Silicone
like
dioxide,
physician grade. Yeah, these are actually like legit supplements that are not scammed or not overpriced and watered down products. So that's one. It's actually a
Right.
good quality of that. And two, some people may end up bashing supplements, and I was on that route before where I was like, you know what, you don't
I've
really
been
need
there.
supplements. Just eat a piece of kale and it has almost everything that you're going to have. But Toni and I worked through my blood work recently, and I had an eye-opening experience where I eat eggs and meat all the time, but I was still low in vitamin B12, and I've been taking like a probiotic too. Now, if I eat eggs and meat all the time, how am I low in vitamin B12? So this is a perfect example. It's like now the day as we get into preventative medicine and taking blood work to look at the results of the blood work that will dictate your diet, your medication, supplements, and base it off of your blood work. I think that's the future there too.
Well, right, that's the difference, right? You're individualizing it to your actual results, as opposed to the shot in the dark,
Because otherwise, I was like, how could I be nutrient deficient in B12 when I eat eggs every day? So it doesn't make sense.
Yeah.
By the way, and my cholesterol is low, so it doesn't. Eggs don't mean you get high cholesterol. So
that's one of my most rewarding parts of having all this time to spend with patients is being able to dispel the lies that they've been told for so many years that come with just conventional wisdom in healthcare.
Perfect. So let's highlight the last benefit. So you also briefed on this earlier about having a network of specialists. Can you expand on that also? What does that mean, and how does that help your members?
Well, so a lot of direct primary care practices have, different affiliations with local specialists, who work in regular offices. This will make sense as I finish this point. And so we try to negotiate different rates for like colonoscopies, endoscopies, and things like that people will probably need. But a lot of direct primary care practices also employ the use of another company that allows them access to hundreds of specialists across the board. Like, you name the specialty, and they're probably on this company's site. It's called Rubicon, and it's really been a game changer. So if there's a clinical question that comes up when I'm in the room with my patient who I just spent the 90 minutes with, and I just need the answer to this one clinical question, and probably otherwise we got it, right? I'd rather not ship that patient off to a specialist and make them incur the time, you know, the cost, the time, the inconvenience, anxiety, or what have you about going to a new place. And so I present the case to one of these specialists and their lab findings or whatever it is, and they'll use, like, 9 times out of 10, it's kept patients from having to go physically see the specialist, because we just need to know, like, is this the right next medication, or is this the right next lab to check, or what have you. So it's essentially what the specialist would have done. We can usually take care of it in our office without having, you know, to make the patients run around town. So that's been really, it's been really nice. And it's for us, it's like nothing to do, but it's for the individual patient. It makes a big difference. So
yeah, I mean, again, just going over all this, I think it's a new healthcare model that is not reactive, but it's proactive. And it's pretty much one-on-one care, high quality care, membership based. And you're starting to not only just, you know, have access to healthcare when you need it, but you're also taking a preventative approach to this to help prevent sickness, prevent disease to this. So I think it's an awesome healthcare model. I think it's the future of primary care. I think you're doing awesome stuff. And if anyone is watching this and they want to find out more information about you and your facility, are you located in Orlando, and what's your website?
Yeah, we're located in the Dr. Phillips area off Dr. Phillips Boulevard, and the practice is called Optimum Direct Care, and so the website's optimumdirectcare.com.
Perfect. And I'll put links to everything below too, so if anyone wants to go directly there, you can just click on the link below. But I'm not going to let you off that quick. You got to answer the Fab 5 questions. Are you ready? Okay. So one is, what book are you reading right now?
Actually, right now I'm reading a book. I think it was maybe written a couple of years ago. It's called The Lies Your Doctor Told You. And yeah, written by a functional med doc who's a primary care doc who essentially goes detail by detail, you know, about the conventional wisdom, things that we thought were true, like eating fat is bad for you, you know, or, you know, there's some more controversial ones that would need a lot more time to explain, but it's a fantastic book. It's a good read. I love reading. I actually recommend it.
I really like reading the functional medicine stuff from Dr. Mark Hyman, Perlamed, or even Dr. Peter Attia, which we had to talk about before about that one. I love reading those new innovative functional medicine physicians now. So next question is, what is your favorite restaurant in or around Orlando?
Let's see. Recently, my recent favorite is there's an Italian restaurant that will do gluten-free, which is nice. A lot of people have gluten sensitivity. It's called Bella Italia, right here in Winter Garden.
Okay.
It's my new favorite.
Yeah. Okay, yeah.
But, so they'll make all the classics and pull out some of the other stuff that people react to, so it's good.
Have you ever eaten at Enzo's on the water?
No. That sounds more exotic for sure than my spot.
Enzo's, so we actually we ask patients this a lot, what are the top 3 restaurants? Enzo's on the Water is voted the best Italian restaurant around Orlando. It's north of Orlando. I haven't been there yet, but everyone says that is one of the top Italian restaurants there. I have to take Haley there sometimes, so I haven't.
Now you're on. You're on the clock now.
Yeah. I just called myself out on my own podcast. Look at that. So next one. Yeah. Who is an under radar small business or CEO who has a business or a product in and around Orlando that you want to highlight, that you really love what they're doing that not a lot of people know of?
Ooh. Probably you, actually. I refer all my patients who need physical therapy services Each and
That's
every one. No, honestly, if you guys
I had like
know about this guy, Pursuit Physical Therapy, he gets patients better fast, even though it is detrimental to business. To get
that's
people,
funny.
yeah, sorry, but that's, he's got a little
You're
office
like
up
the
there in
third one who
College Park.
actually did that. You're the third
Well,
one
you
who actually
didn't give me
said
these
that. I'm like,
questions ahead of time, but
I
that
know.
that
Well,
really is what comes
they're
to
like
mind first.
they're like quick fire questions. So that's good. Well,
I,
thank
I
you for
evangelize.
highlighting me.
Yeah, no, I evangelize for you because you do great work, and
Well, thank you.
the proof is
I
in
have
the
to go
pudding,
and
as they say.
there you go. Well, thank you. I have to interview myself next
Yep,
time.
get him
So,
on the
okay,
show.
so yeah, four is what are you doing or what are you doing that's new and different to keep yourself healthy?
So, I've read a lot about meditation recently, and it just makes sense. I think that we're all doing much more than we are really like intended to do in a day, and our brains are going in a lot of different directions, and we have all these roles. And a body high on cortisol all the time is not doing the healthful things,
Yeah.
right? It's
Me.
not doing the all of
Yeah.
us. It's all of us, right? But it's not doing the healthful things that we know our bodies need, like extracting nutrients, like properly digesting our food. And so I just find that, and I'm horrible at it. I'm horrible at meditation. And I think the more horrible you are at it, the more you actually need to do it. And I tell patients that all the time. And so
Mhm.
it's something I've tried to incorporate into, and like 10 years ago, if I would have like rolled my eyes at me now saying that,
Yeah.
but the more you learn about it, you have to have a balance of the two parts of your nervous system, right? And a lot of times people are running around nutrient deficient because they're high on cortisol all the time and their bodies aren't resting and digesting. And so at a cellular level, all of that influence of cortisol,
Yeah.
it's really impactful. So
Good. So
yeah.
the last question is this is going to be interesting because, well, actually, do you consider prayer and meditation in the same group on that to see the benefits, or are they different?
I think prayer, I know for a fact that people who pray actually enjoy better health. I think
Yeah.
that I think that positive thinking is powerful in general, and in
Yeah.
a way, prayer is just that. It's you're willing something positive to happen, or you're being thankful for something that did happen. And we
Hmm.
know, just like scientifically, epigenetics, right, that
Yeah.
our cells in our body are reactive to the way we think. And so whether it's prayer or meditation or just like having an optimistic attitude, all of those things actually help promote health, or having kind of a carefree, outlook on
Hmm.
things, as opposed to deciding to dwell on your issues or your physical, that kind of thing. There's a lot to be said about that, and science is
Yep.
actually coming up and
Yep.
proving the power of these things. It's called epigenetics, and I think it's a
Yep.
really amazing wave of the future. But yeah, so similar, I suppose,
Yep.
in their health benefits.
I would agree with you on that. Last question, which is going to be interesting because I interview people in healthcare and not in healthcare too. But what is one problem in healthcare that you want to see solved?
Yeah, I think pricing transparency is a big one. And because I think if there were pricing transparency, right, then people just naturally would be able to go where they could afford, or just pin
Hmm.
places against each other, just like we do with the rest of our economy, right? Which in turn should then drive the cost of health insurance down, which in turn
Hmm.
should then make health insurance available to the masses. Right now, it's
Yeah.
astronomical. I mean, I don't advocate for people to
Yeah.
not have insurance, but I certainly understand when they tell me they can't afford it because it's $2,000 a month for their family of four, or what have you. Like, I
Yeah.
get that. Like, people are up against it and they have to make a decision. Do they want to pay their
Yeah.
mortgage? Do they want to pay for health insurance? And like I totally get where people are, but I think if we started with pricing transparency, it would trickle down to that point where everybody would have access to affordable healthcare, and that would be a beautiful thing.
Yeah, I totally agree. That's one of the 5 things that need to be changed, just the transparency and the over-inflated cost of healthcare. That's one of the major factors that hasn't been touched yet to solve this healthcare problem. So overall, thank you very much for taking time out of your day to join us. Sorry about the technology glitches at first, but
sorry about
if
that.
anyone is, it's okay. If anyone is in the Orlando area, surrounding areas too, and you're interested in finding out more information about Toni and her practice, you can Google it also, or visit optimumdirectcare.com. And then thanks again for joining us. And then I'll have all the comments and the links posted below. And thanks again, Toni, for taking time out of your day.
Thank you so much for having me. It has been a pleasure. Everybody have a great day. Thanks.
Bye.
Bye-bye.